So famous. He's father of somebody, something. Father is somebody, father of something. Father is somebody. Non-entity. Father of some non-entity. God. Father of pathology and evolve. Father of pathology.
అదే యానిమల్ సెల్ ఫస్ట్ సెల్
Father of pathology. How? He's not only in pathology, he was a scientist, he was an artist, like science, everything, all in one. He can paint, he can sing, he can act, he can a philanthropist, he can a dramatist and scientist and pathologist. He was the first person who propagated the theory of cellular pathology. Cellular. If a person has fallen sick, మనకు అర్థమే కదా అప్పుడు టాకింగ్ అబౌట్ 200 years 300 years that ఎందుకు ఫాలన్ సిక్ అని అర్థమయ్యింది కదా. He brought out there's a problem with the cell. There's a problem with the cellular pathology. That's how he brought forward cellular pathology. That was the foundation for pathology. So that's why I showed you that slide. This I already showed. This. Now, iliac crest. This is the most important thing. If you tell us the half of spinal cord, intercrystal lines or this is Tuffier's line. ఇలాగని చేస్తున్నాయంటే మీకు బాగా గుర్తుంది టఫ్ నాట్ టు ఫియర్స్ లైన్ టో ఫియర్స్ లైన్ రకరకాలుగా ఆన్సర్ చేస్తారు అనస్థీసియా. మా స్టూడెంట్స్ అనస్థీసియా ఏంటి అంటే వాట్ ఇస్ దిస్ అంటే చూడండి whenever you have entered the OT you must have seen the anesthetist measuring. ఎందుకు తెలుసిన highest point of the iliac crest they are palpating. Highest point of the iliac crest. Machina, if you draw a line from the highest point of the iliac crest toward the spine, that is called intercrystal line or Tuffier's line. It falls around at the L4 vertebra spine or L4 L5 interspace. Induku, why are so specific of that particular interface? Induku, just now I told you spinal cord extends up to L1 in adults, L3 in children. So God forbid when you are injecting the needle, you should not pierce the spinal cord. Spinal cord will get something, you get paraplegia. Temporary or permanent also. So that's why we are very very careful to give an injection below the spinal cord. Where the spinal cord less, they should not be damaged. Anduku, we palpate the intercrystal line or highest point of iliac crest. It's also known as Jacobi's line. Now what are these? See, C7 entry. C7 is the most prominent vertebra of the most protuberant thing, C7. C7 vertebra. That's how you know. Landmark. Then scapula. Andarki telusu scapula. Lowest border of the scapula is in thoracic, the T7. It corresponds to thoracic 7th vertebra. Okay. Now nipple T4. This is T4. అదే డెమటోమ్లో వస్తుంది, నేను చెప్తాను. అది వేరే డెమటోమ్స్ ఆర్ వేరే. దెన్ ఇంటర్క్రిస్టల్ లైన్ ఇప్పుడే చెప్పాను. ఇంటర్క్రిస్టల్ లైన్. Now we'll go to the next slide. I'll tell you about the nipple and other things. The blood supply. Anterior spinal artery. ఇది ఎక్కడి నుంచి వస్తుంది? See, everything has to have blood supply. Otherwise it won't function. Even nerves need food supply, otherwise they won't function. The spinal cord also needs blood supply. So anterior spinal artery supplies anterior 2/3 part of the spinal cord, comes from the vertebral artery. This heard of vertebral artery? Okay. Then posterior 2/3 is posterior spinal. Ikkada very interesting, artery of Adam-Keebles. Artery of Adam-Keebles. This is very key, which how This is very important. Lower thoracic and upper lumbar vertebra completely anterior spinal artery supplied from that. So that is known as anaesthesia arterial identification. Then structures priors. ఇప్పుడైనా చెప్పాను what are the structures midline and parallel. There is a method if your midline you are not able to pierce properly and not reach the spinal cord. What we do slightly paramedian idea is to reach the spinal cord, the subarachnoid space, whether you are going in the midline or parallel. So, ikkada chudandi, these two things are missing here. Supraspinous ligament, if you go in the midline, you will get pass through supraspinous ligament and interspinous ligament. If at all you are getting questions in the NEET, you will be going for a NEET for the study post-graduation. Many questions are from the anesthesia. Majority of the questions will cover in this section. Key question are, what is the difference between midline and paramedial? So the answer is you have to go across supraspinous ligament, interspinous ligament when you are going midline. But you bypass that and you directly go to paraspinal muscles and ligamentum flavum and duramatum and subarachnoid space. The latter, midline, paramedial. So that is how it goes. Now, just now I mentioned what is this dermatome. Dermatome is an area of the skin supplied by spinal nerve. Okay. This area, dermatome is T4. Ikkada defined into T6. Good label. T10. Ikkada. Ligament. L1. This is how dermatome. Indugu. Why it is that? So all the spinal anesthesia treated depending on the dermatome. Transurethral resection of prostate చేస్తున్నాము అంటే you must have up to T10 అంటే బొడ్డు దగ్గర వరకు అంటే నేవల్ వరకు you should have completely paralyzed అంతే amount of give spinal drug so that you are paralyzed అక్కనే ఎక్కువ చేస్తే it's not useful, it's not safe. So we calculated that. So if you are doing higher upper surgery, upper abdominal surgery, so you give it more so that the spinal effect reaches up to. Now when you are doing LSCS, lower segment cesarean section, LSCS and cesarean section chestna normally for delivery of the child is an emergency chestna lecture kuda chestam konni mostly emergency LSCS chestam dantlo so very strange the uterus is chala kinda varaku untundi kada. So the dermatome is 8 and ఉంటుంది చాలా కుప్పలు కదా బట్ we insist up to T4 numbness. T4 వరకు ఇక్కడ వరకు numbness ఉంటేనే we proceed. We ask the surgeon to put the plate. ఎందుకు? Why? The reason is very simple. The uterus is fine but surrounding peritoneum is dead. So that needs to be blocked. That means complete paralysis. T4. The question of the exams. Why? What level of block should be there? What dermatome level should be blocked for cesarean? The answer is T4, not T10. Okay. This is how the question is done. Now, level of block. When the block drug itches on, first thing you paralyze, higher is sympathetic, completely blocked. Inka koncham 2 segments kindane sensory. Inka 2 segments kindane. In the it's all depends on myelination and size of the nerves. I'll say why this magic? Why this magic happens? In the చెప్పాలి ఇప్పుడే చూసాక this is A beta fiber, C fiber, sympathetic fiber, D fiber. They are most sensitive to local anesthetic block. The C fibers, they are the A delta. This you must remember. Question untara exams lo for pinprick for pain sensation which nerves to be blocked and the answer should be A delta. E A alpha, A beta, C, B and the confused అయిపోతారు కదా ఆన్సర్ అన్నీ ఉంటారు A B C. Answer is A delta. Pinprick sensitivity పోవాలంటే which nerve should be blocked and question need blood. So A delta. Okay. That's how you can fix A delta, which conduct pinprick sensation. A beta, A alpha. Resistant any sensory block, A beta. This. ఇది టచ్ కావాలంటే ఏ బీటా పోవాలి, టచ్ సెన్సేషన్ పోవాలి. First thing which goes off is temperature, then the touch, then the pinprick, then the proprioception. What is proprioception? Any idea? Proprioception. Joint feeling in the joint section. If you are moving a joint as you feel or orientation of space or body, ఎలా మూవ్ అవుతుంది మీకు కదా, in which area ఎక్కడ ఉన్నావు అంటే మీకు టెలింగ్ యూ, కళ్ళు మూసుకున్నా తెలుస్తారు నేను ఇక్కడ ఉన్నాను. That is control. That is analyzed by A alpha. A alpha. Okay, fibers. So these are the various depths. Depends on the myelination. More the myelination, chances of being affected is less. Unmyelinated, naturally effect will be faster. And the thickness of the nerve. Recovery will be exactly opposite. The first thing which will go, this is it follows the reverse order. Motor function will come first, followed by touch, then the pinprick, and finally cold sensation will come. When it is affected, first thing which goes off is cold sensation, temperature sensation. Next thing which goes off is pinprick, then touch, and finally the motor function. But here, when effect after 1.5 hours, 2 hours, final effect passes kada. So the thing which comes back is motor function. Patient starts moving, but pain is tolerating the surgery. He's moving. Don't get worried. And the patient is moving, spinal effect పోయింది కాదు. ఇంకా చాలా టైం ఉంది. టచ్ సెన్సేషన్ పోవడానికి ఇంకా చాలా టైం ఉంది. So surgery can be done. That is how we work. So these are the various positions you must have seen in the operation theatre. This is jackknife position. Oh, this is the jackknife position in the. This is the jackknife position. This is the lateral decubital. Decubital. That is the aim position. Decubital. Decubital का कर लीजिए. ఇది sitting position. Most easy thing is sitting. ఎందుకంటే most of the patient will be obese. Obese లో అసలు మిడ్ లైన్ మనకు కావాలి కదా. వాడికి ఎక్కడ మిడ్ లైన్ ఎక్కడ లాటరల్ వాడికి తెలియదు, మనకి ఎలా తెలుస్తుంది ఇంత ఉంటారు. సో అక్కడ మిడ్ లైన్ అలాగే ఉంటుంది. మంచిగా పాల్పేట్ చేయడానికి సిట్టింగ్ పొజిషన్ ఇస్ ద ఈజియెస్ట్ వే. You must have seen that most of the surgeries when you are giving spinal, we make the patient sit. The easiest way of giving. ఎవరో మాట్లాడుకుంటున్నారు, ఏదో డిస్కషన్ చేస్తున్నారు చాలా సీరియస్ గా. తర్వాత డిస్కస్ ఇచ్చేది ఇంకా 5 నిమిషాలు అంతే, ఇంకా క్లాస్ అయిపోతుంది. బాగా డిస్కస్ చేయాలి. ఓకే, నెక్స్ట్ స్లైడ్ ఏంటి ఇది. These are the various needles. మన most of the time we are using pinky needle. Pinky needle is cutting needle. It has got too many disadvantages. Why are మీరు క్వశ్చన్ అడుగుతున్నారు, ఎందుకు? There are so many designs, cutting needle. Why are you using? Chances of PDPH is very high. Posterior puncture index is very high. And why are you using surgery? ఎందుకంటే firstly it is cheap, secondly it is easily available, thirdly it is user friendly for the learners. మనం వచ్చిన మీలాంటి వాళ్ళే after 2 years you may join anesthesia. We will be giving you also pinky needle. ఎందుకు? It will be easy to learn. అంటే మీకు పొడవటం ఇది చాలా ఈజీగా ఉంటుంది, తెలుస్తుంది. రాగానే పెన్సిల్ పాయింట్ నీడిల్ ఇచ్చేసాను కదా, స్ప్రాట్ విటాకర్, యూ విల్ బి కంప్లీట్లీ లాస్. పక్క అమ్మాయి కూడా పడిపోతుంది. ఇప్పుడు అయితే తన పడిపోతుంది, నెక్స్ట్ అమ్మాయి కూడా పడిపోతుంది. ఆల్ కెనాట్ బి సింగ్. ఓకే, సి దీస్ ఆర్ ద వేరియస్. ఈ కలర్ ఉంది, కలర్ కోడింగ్ తో మనకు తెలిసిపోతుంది. Color code is which gauge, which is the thickness of the needle. Giving various. What is this? Is dura cutting and dura splitting. మనకు కావాల్సింది with dura splitting. That is vitakal. And pinky is normal. రాలేదు కదా. I started the class more than 10 minutes after. Why should you? You have to go somewhere? I'll quickly. These are the motor assessment, how you assess Bromic scale and that. This is commonly used spinal anesthetics, spinal nerve roots and dorsal drug uptake. This is the different Vezal's RS reflex, how it works after giving spinal. Main bridge reflex, parasympathetic. Thermoregulation, sympathetic hypothermia. Factors affecting the block height. That's baricity. Baricity is nothing but density of compared to the CSR. I know what is density. Density is the mass divided by volume of that thing. The specific gravity is similar to that, but compared to water at 4 degrees Celsius. PDPA is the post-dural puncture headache. Barcotal and a little bit of CSF, we withdraw and then pumping. That is high spinal and chala ekku. Total spinal and it has gone into the brain and that completely paralyzed. Respiratory effect and the cardiac effects will be stopped. Then, this is epidural, which I have mentioned already how it is given. Anatomy of the epidural. This is the epidural space and thickness. These are the regions. How much you should give? 1.5. If you want to give cervical region, this much per segment. And the type of surgery, depending on the type, the perineal only 10 to 12 ml of epidural. If it is thoracic, you have to give 20 to 22 ml of epidural. These are the various types of spinal needle. Question Rajan, what is the name of the epidural needle? Answer is made in Chestnut, TUOH1. Two-he. That is the answer. Question Rajan. Which is the epidural needle we use? Two-he, TUOH1. Okay. What is the difference between spinal and epidural? Already checked midline approach again checked. Technique of epidural checked. We got a differential block advantage. Caudal. This is the caudal block. This is the triangle space. How it is formed? Failure of fusion of the lamina of the S5. That is caudal. This is anterior superior. You have to draw a triangle. The posterior superior. Where is this posterior superior leg span? See, there is a dimple. Ikkada dimple untadi kada. That is correspond to S2. To akkada ipsilateral triangle form chesavante, the tip is the place where you have to give caudal. Okay, this is the answer. And caudal epidural anesthesia. This is how you are going to see caudal epidural anesthesia. Intravenous regional anesthesia, vedu kuda ear blockade. This is how he has given.